Medical professionals of Reddit, what's the most obvious case of faking it you've witnessed? Called to a bar for a seizure. Waitress says she delivered his bill, and he suddenly went to the floor having a seizure. Look over at him, and he's laying there flopping his arms and legs around, as he looks us right in the eye and screams over and over, "I'm having a seizure." We tell him to stand up so we can take him to the ambulance. He does and starts walking to the door. We tell him to hold up, gotta pay your bill first. Man, was he pissed at us. Waitress tells us he does this all the time. Well, not today. He still took a ride to the hospital though. The hospital has good egg salad sandwiches. Not quite the same thing, but in the ER. A woman came claiming she was in labor, so got her on her way to Landy. Landy sent her back saying she was faking it and needed to go to the psych ward. Quick physical exam showed that was false because the baby was crowning. Sent her back to Landy, and from what we heard, baby was delivered in the hall on the way there. My mom had a patient who said she had passed kidney stones at home and needed painkillers. The lady actually brought in the kidney stones as proof. Patients don't usually do this, and the stones were way bigger than people can pass on their own. My mom sent them to the lab and they came back as geological origin. Aka, crazy lady picked up small stones from outside to try and get meds. Veterinarian here for something different. Performed a cruciate repair on a miniature poodle, and of course the dog limped post-op. Came in for radiographs a month later to confirm healing, looked great, but dog was still limping. 2 months later, the owner was furious that the surgery was a waste of $1,000, threatened to sue, but on examination and re-radiographing the leg I couldn't find a thing wrong. On a hunch, I asked the owner to leave the dog with me for additional tests that would be of no cost to her, so she went shopping for an hour. During that time, I set up a video camera to record the dog in the kennel run. The moment the dog didn't hear the owner or the car anymore, boom, all 4 legs working like a charm, dog running around perfectly normal. Called the owner and asked her to return after half an hour, set the camera to record again, and the moment the dog heard the familiar car returning, the limp came back as well. I had a fun few minutes explaining to the owner that her dog was faking the sore leg for attention. Got the usual "oh no. My fur baby Schnooky Wookums wouldn't do such a thing." So I showed her the footage, clearly showing her dog running around fine, as well as showing what happened when her car returned. Instructed her to ignore the dog while it was limping. Limp magically went away after a week of not getting attention for it. I had a woman come into triage in labor and delivery. We ruled her R for breaking her water. She was pissed that she wasn't going to get induced and be delivered. So after I left the room, she flooded the bed, the floor and herself with tap water. Literally gallons and gallons of water, it was leaking out from under the door. So much water it was like that scene in Coneheads. She said it was her water breaking. Again quickly ruled her out and told her she needed to go home. She subsequently peed the bed before leaving. My senior year of high school, I was a part of this EMT program where I could ride along in an ambulance. One call was way out in BFE for a woman in labor. This lady, who was on her 6th pregnancy, said her water broke, she's having contractions, etc. She's holding her belly, wincing, squeezing her man's hand, all that good universally recognizable stuff. Well, guess what happens when we gurney her up to the L&D ward? She stops all of the groaning and wincing and calmly says to a nurse, "I have an appointment at 9 o'clock for Dr. A to induce me." Induce you? You just told us in the ambulance you weren't supposed to have your baby for another 2 weeks. You were faking contractions every few minutes. We had already called the hospital and asked to have a team ready for delivery. Well, the nurse shakes her head and goes something like, "Oh no. Since this is an imminent delivery, Dr. Z will be helping you today. We've got a room all set for you to push. You won't be making your appointment today." I started laughing because this nurse sees through her shit, and the paramedic I rode with was like, "Yeah, this happens all the time when someone needs a ride to the hospital but doesn't have one." When I wanted to be a physical therapist, I volunteered at one of my local clinics. We had a lady who claimed she was in excruciating pain. She couldn't walk more than 5 feet without literally screaming in pain in the clinic. She couldn't even move her toes without yelling profanities. She kept talking about how her meds ran out and needed more. She also started talking about how her whole family thought she was an addict, but she swore wasn't. I started feeling for her a little. She seemed nice and like she was going through some mess. But then once the doctor walked out of the room, her and I got to talking about music. I told her my uncle was in a bluegrass band and she mentioned how much she loved bluegrass. She loved it so much that the prior weekend, her and her husband spent 14 hours at a festival. She was tired, was carrying chairs around and dancing. And they were traveling to go to another one the day after her appointment. When I asked her if she had any pain during the festival, she said oh, none at all. It was a fantastic weekend, and then realized she gave herself up and got real quiet. I worked as a nurse on a cardiac floor. Chest pain was the biggest thing people would use to drug seek, because if nitro isn't working, we also give oxygen and morphine while turning it into an emergent situation. We even have an acronym for it: MONA, morphine, oxygen, nitroglycerin, aspirin. All are interventions for a heart attack. When you have a heart attack, your cardiac tissue releases these markers. Kind of a distress signal. We can pick these up on a blood test. Sometimes a heart attack can be seen on an EKG. If a patient had a history of negative tests and/or multiple admissions and all their vitals were normal and I expected they were faking it, I would ask them if it hurt when I put my hand on their chest. They would always say yes, and then I could happily inform them that this likely wasn't cardiac, but muscular pain, since heart attacks won't cause pain when your chest is touched. I would suggest a warm compress and some Tylenol, and their pain was always mysteriously gone within seconds of my announcing that it couldn't possibly be related to your heart. Woman shrugging. After a while you do get very used to the signs and symptoms of people actually having a heart attack. There's just no faking that level of panic or the look on their face. I had an attack of acute gastritis once that presented all the classic symptoms of a heart attack: shortness of breath, pain in my left shoulder and chest radiating down my left arm, etc. In the ER, they checked me out thoroughly and could not find any sign of heart trouble. The pain persisted even after they gave me morphine. Finally, they gave me some sort of stomach antacid intravenously. I had already taken Pepto-Bismol earlier in the evening. The pain almost immediately subsided. They kept me overnight for observation, but said my heart was perfectly healthy, and that gastritis can sometimes feel like a heart attack. I have a long history of really bad GERD, Barrett's esophagus, hiatal hernia, IBS, and panic disorder. Just 2 years ago, I was laying in bed late at night and all of a sudden this horrible pain came on in my stomach and into my lower back. I tried breathing exercises, taking an extra couple of Klonopin, and anything else to prove to myself it was just stomach issues that I was making worse with panic. The pain just got more and more intense, but I didn't want to go to the ER as I have a horrible history of going and nothing being wrong, and I feel so damn embarrassed. Finally, about 3.5 to 4 hours into the pain, I admit defeat and call an Uber. Get to the ER and the gal at the front can tell I'm in massive pain and asks if chest is hurting. I just say, well, maybe it's my hernia, so she takes me back to triage. Takes my BP and obviously was alarming to her. From that point forward my memory isn't all there. Next hooked me up to an EKG, and I blabbered on that it would turn out negative just like every other time. I mean, it wasn't a split second after she printed it out that a team of nurses and doctors rush into the triage room and tell me I'm having a massive heart attack and need surgery ASAP. The next few minutes I remember were me screaming that I was afraid of dying and calling any family member whose phone number I could remember. I had 100% blockage on left and 80% on right. 2 stents put in the night I arrived, then stayed 2 more nights in cardiac ICU, and got 3 more stents. Quite shocking to me since I was only 39 at the time. So, no matter whether one may think it's nothing, get thee to the ER. I still can't believe I survived having waited so long. Oh, and it's not lost on me that the one time, I wasn't having a panic attack thinking it was a heart attack, well, there it was. My mom had a frequent flyer at the emergency room she worked at. This lady was constantly in unimaginable pain over everything. She got a splinter in her finger, and that constituted a 10 on the pain scale, and she needed painkillers to deal with it. She was a known drug abuser as well. She had been caught stealing needles and shoving them up under her huge sweaty boobs. The only reason my mom found out was because she came back in to place the EKG pads, and to do so, she had to lift her boob up to place the pad. When she did, the needles rolled out. From that point on, they had to have a member of security watching her any time a nurse or doctor left the room. She also had a massive arrest record, and there were times the cops would bring her to the ER instead of an ambulance. Pediatrician here, so my patient was younger, and I think influenced by mom. This 13-year-old kept getting admitted for complaints that never made sense. Lack of smell. Dizziness. Seizures that would happen while he was walking/running. Heart felt hot, etc. Every specialist under the sun had seen him and cleared him. He had every test and imaging study you could think of. There was a lot of social stuff going on, and this was a hard family to discharge. He'd get admitted, we'd run 100 tests, and as soon as we were about to discharge him, some new symptom would come up. The worst was once after I had already written the discharge orders and the nurses called to let me know the patient had gone blind. I was grouchy that day and wasn't having it. I went in with a rolled-up piece of paper. I checked his pupils. I used a Snellen. I went through the whole rigmarole. Then when I was talking to his mother, without looking I threw the paper at him hard and fast. He yelped and dodged it. I told Mom that they were going home. To be honest, I still feel a little guilty about it, and don't know what the right thing to do was. I posted a while back, but will post it here again. It wasn't super obvious at first, but after looking into her records it became clear. So this happened a few months ago on my psychiatry rotation in medical school. There was a patient at an inpatient psychiatric facility for suicidal ideation. She constantly insisted that she had a mass on her breasts, and demanded to be physically examined only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during my daily patient interview. I also declined physical exam, but had a bit of a hunch to check her medical records. It turned out she had an ultrasound done a week before that found only normal breast tissue without masses. However, apparently this lady had frequented many doctors' offices with various complaints of an unspecific nature, and would usually focus on breasts or vaginal complaints when she visited male physicians' offices. We diagnosed her with factitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. It seems her goal was mostly attention from medical professionals. She had lots of issues, but we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously. A bit late to the party. I had a patient who was supposedly comatose, but was giving a few mixed signs when it came to making a definitive judgment. There is a test called a drop arm test, where you raise the patient's arm over their head and drop it. A non-comatose patient will move their arm on their own to avoid hitting themselves in the face. But I had a different idea. With the nurse in the room I said, "Okay. Our defining test. If his arm stays straight up unassisted, he is comatose." I let go of his arm, and it stayed totally upright. The guy did himself in. I told him shortly after that the gig was up and he had no medical reason to be admitted. My grandma used to work with a lady at a hospital, funny enough, that would always say she got an on-the-job injury and needed to take a few weeks workman's comp. A doctor there would somehow always give her a note and she would get a free week or 2 vacation, come back for a month, and do it again, obviously milking the system. One day her boss said, "Okay, but there's nothing for you to do here on light duty. Usually we'd send you home until you're better, but we're going to have you come in until you're better." "But there's nothing for me to do," she said. He told her, "I know, bring a magazine or something. It'll be a long day sitting in the break room." She lasted 2 days and never pulled that stunt again. When I was a labor nurse, the emergency room sent up a gal who said she was in labor. She was a sturdier lady, so it was hard to tell. No prenatal care. No fetal heart tones. Did an ultrasound. She'd had a hysterectomy. She and her partner insisted we were wrong because they prayed and knew they were having their miracle baby. Good luck with that, ma'am. This person had a long mental health history. I have no doubt that she believed she was pregnant. We had a patient come in on a workers' comp case with severe injuries to the chest. He states that while working in a grocery store parking lot, a female deer spots him from a distance and decides she wants him. Once she gets close to him, she kicks him in the chest several times and then headbutts his kneecaps in. Once he's on the ground, she stomps on his chest and head. He wakes up several hours later and immediately comes to us. Not only was his story completely ridiculous, but he didn't have a single mark on his body. No bruising, no swelling, no broken bones. Just nothing. He rated the pain at a 10/10 without a single scratch on his body. Needless to say, he got his claim denied. I am kinda late, but I am an X-ray tech, and when I was a student, these two people came in. A man who was pushing a woman on a wheelchair with an ankle boot. They both looked like junkies. Anyway, they came in with a prescription for an ankle X-ray. They asked if she has to take off the boot, and I said yes, because obviously it would superimpose on the anatomy. She all of a sudden starts crying, saying that it was too painful. No tears. The man said she broke her ankle in 3 places some time ago, and her ankle becomes curved when she takes the boot off. Okay, dude. Ankle X-rays are easy. Take off your shoes and socks, 3 views, boom, done. But no, says she cannot get on the exam table, and she needs people to hold her ankle together. We literally had 4 X-ray techs working this high-profile case. 1 to hold the digital cassette, 1 to hold her ankle in place. 1 to hold the chair we had to put her ankle on, and 1 to push the button to shoot. We did this all while she was screaming in pain, and she even said, "Kill me, pleeeeeaassee." The funny thing? All the X-rays showed no abnormal findings. No old fractures, no screws or plates of any past surgeries. Literally a perfect intact ankle. They wanted painkillers for sure. They looked like drug addicts and had a plan to get more. So annoying. Edit, grammar and spelling. Had a frequent flyer patient who did have some legitimate medical issues, but you could tell that there was more to it than that. Patient would tell us to push 4 narcotics as fast as possible because it works better. Also had the usual "I'm allergic to every single weaker painkiller but dilaudid" story. I suspected they were also fudging some admissions information, was making the rounds at area facilities, but that's another story. Patient had to self-catheterize due to a bladder problem, but would regularly come in with raging urinary tract infections. While catheters can cause UTIs, the frequency and severity didn't seem to add up, on top of the other questionable aspects of this particular patient. Turns out, patient was putting their feces on the catheters before inserting them to cause the infections, so they could come into the hospital for meds. Got called for a seizure to a park well known to be full of homeless drug addicts. We walk up and there is a man, laying in the grass in no distress. As soon as I say hi there, he starts shaking his whole body, and yells, "Oh no, help me, I'm seizing," and his friend says, "I think you need to give him some Ativan for the seizures." Had a point come in with uncontrolled diabetes. He was type 1. His BSL was really high. A couple days and it was back under control, and he was ready to be discharged when they went out of control again. Those pattern continued. About 7 a.m. one morning, his girlfriend fronts me needing a note for the judge. He was supposed to be in court at 8 a.m. He'd been eating wild amounts of food to try to get out of going to court, then wanted us to fix the situation with 1 hour notice. We did nothing. He went home about 11 a.m. I am a firefighter, and we have quite a few calls about people faking medical problems. The most obvious call that I have ever been on when someone was faking was a woman that looked to be in her 20s super drunk. The first call we had was about 1 p.m. We arrived on scene to this woman having seizures, but we could easily tell she wasn't because she was making direct eye when we were talking to her, and she was even responding to our questions while she was having one of her episodes. We never come out and say that you are faking, but we do ask if you are pretending to have seizures, and if you say no, then we do our best to try and make you go to the hospital. Well, her family and her said that they will just keep her home and watch her, and if it happened any more they would just take her to the hospital theirself. We had another call from the same address about 3 hours later for the same female having seizures. So we arrive on scene again kind of pissed since she woke us up for having pretend seizures again. When we walked back in the house, she was laying in the floor again, flopping around like a fish in a sea of all different kind of alcohol bottles. This time she gets an attitude with us when we ask her if she was really having a seizure, and we weren't having any of it. My captain got on the radio and called to have a deputy come out and assist us with dealing with the crazy wasted lady. Next thing you know, when the deputy pulled up in the driveway a few minutes later, she was up running around screaming at everyone because she said that we aren't giving her all the medications that we are supposed to give her. So long story short, she was told she could either go with the deputy to jail or she could go with the ambulance. She said that she would rather go with the ambulance. When we got the stretcher brought inside for her, she started saying that it was all a joke and that we needed to get the hell off her property. But she then got into one of the paramedics' face and started screaming swears at her, so we all got a hold of her and put her on the stretcher and then strapped her down with all the straps that we had just to keep her still. The deputy said that we better take her to the hospital just to get checked out, so that is what we did, and she screamed and cursed at the paramedics all the way there. I was a combat medic in the army, and faking an illness or injury is extremely common. But I always gave it a pass because unlike any other job anywhere else, getting a sick day is damn near impossible. At least in my unit. So if you came in with a fake cough or told me you had the shits, I would tell our PA to give you 2 days of bed rest. He didn't give a fuck and did whatever the line medics asked him to. The real crazy shit is from people who you know are faking and trying to get out on a medical discharge. These are almost always people in their second enlistment because after 4 or 5 years in the army they know how the system works. We had a fellow medic do this shit. He was a former Navy corpsman who re-enlisted in the army as a medic. He was also a real shitbag. Schmoozed with the right people in the platoon, so no one never knew where the fuck he was half the time. Usually he was sitting at his house on base playing Xbox with his wife. Personally, I'm under the assumption that he re-enlisted solely to fake a service-connected injury so he could get out with full disability. Anyway, we were an infantry unit about a year out from a deployment to Iraq when this guy showed up. One day we were holding some training for the Joes using CPR dummies. Some of these dummies were over 150 pounds and used to simulate carrying dead weight. We were moving them around the area when we heard a crash from the other room and a loud scream. We rush in and Navy corpsman was sitting there holding his arm and wincing like he got hit by truck. He made up some vague story about pulling a muscle when the dummy fell or some shit. For the next month or so this guy would walk around with his right arm, held out bent at the elbow, L-shaped, with his palm up and his hand frozen like a claw. Imagine your arm in a sling but twist the hand into a claw and hold it palm up and you get the idea. It was fucking hilarious. One day he gave my buddy a ride in his car, and he used his good hand to put his clawed hand on the shift between the seats and used his good hand to pull that hand so he could switch to D. I'm laughing just thinking of my buddy laughing his ass off telling me this story over beers later that night. This fucking guy milked that shit for everything it was worth. His fake injury gave him the perfect excuse to fuck off. I'm at the hospital, or I have an appointment with orthopedics, or some other shit. He eventually did get his medical discharge, which meant he had another reason to fuck off, because he had all sorts of appointments with the discharge people. And the rest of the platoon was too busy getting ready for a combat deployment to babysit his ass, so, whatever. I always figured that if someone is in the military and wants out, it's better to give them the boot. Keep them in and all it does is fuck up morale, because all they do is sham and complain. You get an older guy doing this shit, it puts bad thoughts into the younger/newer guys. So fuck him. Get him out of here. I don't care. The only thing that bugs me about this guy is that I know that this dude used every piece of knowledge he had, which was actually pretty considerable, to get more disability than dudes who got fucked up on combat ops during our deployment. Pro tip, if you're in the military and want to know if someone is fucking off, call them up and ask them where they are. 9 out of 10 times they'll ask where you are before answering. That way they can say they're somewhere else. I mean, you don't want to say you're at the company CP when the guy calling you is standing right in front of the company CP.